Good morning, distinguished guests. Good morning, everyone. Your Excellency, the Governor of Lagos State, who's been very duly and ably introduced and welcomed. The Honorable Minister, ably represented here by Professor Wasiu Lanre Adeyemo, the CMD of LUTH. The Honorable Commissioner of Health of Lagos State, Professor Akin Abayomi. All our partners and colleagues, members of the press, ladies and gentlemen. Let me start by thanking you for taking the time to join us on this special occasion. We appreciate your presence as we celebrate this major milestone in Avon Medical practice and within our larger group, the Heirs Holdings, as we continue on this journey to transform healthcare delivery in Nigeria and across Africa. This is particularly emotional for us at Avon Medical. It's a moment of pride and deep sense of fulfillment. And please permit me to just tell you our story, because it's when you understand where we started that you will better appreciate what this moment means, not just for us, but for many families across this country. So in 2009, the journey officially began. The decision was made, and we took the first step. A bold step to make world-class healthcare accessible and affordable to all. Not just for the wealthy, not just for the privileged few, but for everyone. We were focused on the problems, which we all sort of have an idea of. We saw them all around us. Overburdened public hospitals, lack of modern equipment, medical professionals being stretched to their limits, and a lot of people, simply being frustrated, not being able to get medical help in time. And we couldn't look away, so we decided to do something about it. So that single decision to step in gave birth to Avon Medical, which you see here, and the health insurance company which we have, Avon HMO. The first was to provide excellent healthcare services, and the other to ensure that people could actually afford them. That combination was deliberate. It was our way of ensuring that we were not only building facilities, but we were also creating access to them. So fast forward to today. From our humble beginnings of operating just one worksite clinic at a single location, we've grown into a 50-bed hospital network, including a dialysis center, which is currently located at Ikeja, and several worksite clinics, both in Lagos and in other parts of the country. So let's pause for a moment and ask this simple question. Why? Why should any of this matter? When we reflect on the staggering facts about our healthcare system on our continent, we will understand why. Africa carries over 20% of the global disease burden, yet has access to only 1% of healthcare resources. Approximately 48% of Africans lack access to quality healthcare, which we all need. Only about 3% of global health workers serve our continent. In Nigeria alone, the gap in the number of available and qualified doctors, beds, equipment reflects a system under pressure. The African healthcare system is the hardest hit by the migration crisis. Now, these are not mere numbers. They represent people, real stories, real lives. And far too often, they represent women and children, which is why this facility matters. Because now, more women will receive the maternal care they need to safely bring life into the world. It means more children will get timely diagnoses, life-saving treatments, and a better shot at long, healthier lives. It means more families will have access to quality and affordable healthcare services that they deserve. That is what we are building, a healthcare system that leaves no one behind. Ladies and gentlemen, what you see here today is a reflection of our philosophy as a group, Afri-capitalism. The belief that the private sector has a major role to play in our continent's development. The belief that we have a responsibility not just to generate profit, but most importantly, to create a lasting impact, to do well and to do good, to solve problems, to improve lives that will transform Africa. And I want to be clear, we are not stopping here. This achievement is not the end, it is only a springboard. Our vision has always been bold, to create a network of health solutions that are not only accessible and affordable, but also world-class. We will continue to empower individuals to live healthier, fuller lives and restore hope in Africa's health system. To achieve a developed Africa, we must have healthier Africans. It is possible, it is achievable, and we will get there. But we were able to achieve this feat because we have passionate teams across Avon Medical and the wider Hares Holdings Group, a group that is committed to building solutions that improve lives because we believe Africa's solutions lie with Africans. We can achieve major feats because we have people who are committed to our vision. To our team, those seated here and those who are not here, I say thank you. This day belongs to you. We are also grateful to the public sector for their unwavering support. We want to especially appreciate the Lagos State Government and the Ministry of Health for creating an enabling environment that encourages private and public collaboration. This is how we make real progress together, collaboratively. To anyone who uses our facility, we promise you excellent patient care. We are here because of you, and your health matters to us. I would like to specially acknowledge our frontline medical workers, both the clinical and the non-clinical staff. We see you, we honor you, and we thank you. And we appreciate all your daily efforts caring for everyone who walks into our facilities. And finally, to our guests, friends, supporters, thank you again for being a part of this story. You are helping us write a new chapter in Africa's healthcare narrative. We believe that Africa's future is bright. We believe so much in the potential of the continent, and today we celebrate a promise kept. Thank you very much.